Are you somebody dealing with sciatica or low back pain and having a lot of difficulty sleeping? Well, this episode is going to help. Hey guys, I'm Dr. Josh. Today's episode is going to be about sciatica, disc herniations, and low back pain, especially if you find it difficult when sleeping. It's really difficult to sleep when you have a tremendous amount of pain or even a mild amount of pain, especially when it hurts in the middle of the night or early in the morning, flipping positions, and it can really set off pain that not only starts at night, but it can make the pain in the morning worse and make the rest of the day just flat out stink. So we're gonna show you our top techniques that we teach our patients so that you can help yourself. Now, before we get started, it's really important to note that as we go to bed, there's a natural process that decompresses our spine and our disc. This is called imbibition, and that natural decompression coupled with the compression of a herniation or a disc bulge can cause an immense amount of pressure. So it's really important that you maybe ice down, maybe you do some exercises, some gentle exercises before you go to bed. And I'm not saying just before you go to bed, maybe within an hour or two. So maybe you finish up dinner, you do your thing, you maybe go for a 5-minute walk. It doesn't have to be aggressive. Or maybe you do some of those McKenzie press-ups before you go to bed, and then you start off that. Now, once you get into bed, everybody knows to put a pillow in between their legs, but I'm gonna show you something else in addition to that. So first things first, let's talk about sleeping postures and positions. Laying on your belly might actually provide you a little bit of relief, but doing too much can also cause it to be worse. So if you lay on your belly for about 2 to 3 minutes, maybe a little bit more, maybe a little less, you might find some relief, but it's very likely that if you stay there, it's going to increase your pain. So according to the research, one of the best ways you can sleep to help reduce pain into the disc is actually to be on your back. Now, I know that's very difficult to do that, but what you're gonna do is basically put a bunch of pillows, heck, you may even have to put 2 onto your back, and you're gonna just lay down like this, and you may even want to give a little bit of movement into here. If you can sleep on your back, that's great, but if you need to sleep on your side, that's okay too. So assuming this side is the bad side, so let's pretend this is the bad side. I like to have the bad side up for most of the time. And that being said, I will put a pillow in between the knees just like this. And if you really want, what I find that is putting an additional pillow underneath the feet like this. So you have one pillow on your knees, and then you have one pillow underneath your feet. That typically dumps the pelvis in this position, and it makes it feel really, really comfortable. And what you really want to do is focus on nice spinal alignment and trying not to hurt it. Now, here's the big issue. When you have to roll or sleep at night and move to the other side, most people thrash and they do stuff like this and they turn their hips and torque it. When your body is trying to decompress and when it's trying to alleviate the pain, and then you keep a neutral posture and then you go ahead and ripping it across, it can cause a lot of irritation. So what you're gonna do is you're going to literally move as a unit slowly like that, okay? So if I come from this side, I'm gonna come here and I might have to put my feet on the ground. I'm not gonna jump like this, okay? I'm going to move as a unit and I'm gonna do this to help alleviate the pain into the spine. Again, we don't want to irritate it or create more irritation. It's already aggravated, so let's calm it down the best we can. In addition to sleeping on your side with a towel or a pillow in between your legs and now one underneath your foot or feet, this may help, but you may want to take a small little towel and put it underneath the pelvis. And that's because if you put it underneath the pelvis like this and you just elevate the pelvis just a tad, it can open up the spine just a little bit and create a little bit of breathing room into that nerve on the side. So it'll look kind of like this. Imagine put a towel under here, under the pelvis, and we're gonna kind of be in this position because the feet are gonna be elevated, the knees are gonna be here, and then you're gonna have your hips up a little bit higher. And sometimes patients find that it is really beneficial to get and do this. Sometimes you need one of them, sometimes you need 2 of them, sometimes you need 3 of them. It's all different variations, and it really just matters what works for you. But the traditional way of just putting a towel or a pillow in between your legs does help, but if you can do a little bit more, that can help as well. Finally, it's really important to note that when you get up from bed, I know it's really achy, I know it's really sore, but it's really important that you get out of bed properly. So what that means is that when you're on your back, you don't get out of bed like this. and you hurt yourself, okay? Starting off the day with bad back pain and irritation is just going to make it worse. So you don't wanna throw yourself into a violent push-up or sit-up, okay? So what you're gonna need to do is you're gonna come here, you're gonna press your leg, you're gonna dangle your legs off the ground or floor, and you're gonna push yourself off just like this. And then you're gonna stay here for about 3 or 4 minutes. Once you stay here for 3 or 4 minutes, then you'll get up and then you'll start your day. And by not irritating it first thing in the morning, that's going to help you when you get out of bed. Now, before you even get out of bed, it's really important that you get a little bit of motion into the spine first. Because remember, we just had some swelling of the disc due to some decompression, and now you have that compression. It's really important to wring out the disc a little bit and get a little bit of fluid movement within the spine. So before you even get out and get out of bed, what you want to do is just do some windshield wipers. Get a little bit of movement. It doesn't have to be all the way down and a stretch. It just has to be a gentle movement of the hips and pelvis. My spine is moving back and forth, side to side. You could do 5 on each side. You could do 10 total. You could do 20 total. It's totally up to you. But once you do that, then you're going to roll up to your side. And then once you roll to your side, instead of getting out of bed like this and hurting off your back and starting off the day in a bad note, you're going to go onto your side, keep the spine nice and straight, push off, elbow down, lay off the side. If you need a little help, you can dangle your feet off the ground and you're gonna push off. Then you're gonna stay here for a few minutes. Once you stay here for a few minutes, then you can get up, start your day, and I highly recommend that you start off the day with some good quality movement. Don't bend over the sink, don't wash your face, don't do that right off the bat. Start off with movements that are healthy and quality and not going to irritate you. If you start the day off when you irritate your spine, it's likely going to increase the spinal pain, the numbness, the tingling, the sciatica, the burning sensation for the rest of the day, and then you're gonna be behind the 8 ball for the next day. So make sure you learn how to not only sleep properly and get out of bed properly, but not create more irritation and more insults to your body than you need. If you found this helpful and you think you need some help, make sure you download our free lower back pain guide. These are some of the best exercises that we recommend to help alleviate some of the pain and help you get back to your life. It is a very good guide, and I promise you it will help improve the quality of your life when it comes to this lower back pain. Thanks again, and I'll see you for the next episode.